Welcome to the Academy of General Dentistry podcast series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Hey, welcome back, everyone. We've got another fantastic show for you today as I welcome my good friend, Dr. Mitch Gardiner. But before we begin, make sure you subscribe to our channel, hit the like button, and ring that bell. This way, you'll be among the first to be notified of all things AGD. Hey, Mitch, how are you?
George, it's good to see you again. I miss teaching with you up at Rutgers, and they certainly do miss you a lot.
Yeah, well, I appreciate the kind words, Mitch, and of course, I miss you too. Let me just tell our audience a little bit about you before we begin here. So, Dr. Mitchell Gardiner is a graduate of the University of Medicine and Dentistry of New Jersey, and a veteran, having served for 3 years as a dental officer in the United States Navy. Thank you for your service, Mitch. He is a clinical instructor at the Rutgers School of Dental Medicine and the Department of Restorative Dentistry. He has over 25 years of experience in reviewing dental malpractice cases as an expert witness. Dr. Gardiner lectures and presents programs on issues of dental malpractice throughout the United States. He holds fellowships in the Academy of General Dentistry, the American College of Dentists, and the International College of Dentists. Mitch, like I said, it's really great to have you on the program. And, that's what I want to talk to you about. I want to talk to you about malpractice, and I want to talk to you about a little bit about the process, because fortunately, I guess for many people, they're not aware of how that works, but unfortunately, some folks kind of get in trouble every now and then. And what is the role of the expert witness, Mitch? And explain to us a little bit about how that whole process works.
So, George, basically what happens is in the dental malpractice and dental negligence world, when something happens badly to a patient, whether it be an injury, and it's typically an injury, but it can also be bad dentistry or a bad result. Many of our patients, and I practice full time, so this is my world as well as everybody who's listening to this. Patients will look for ways to recoup either money, or in injuries, they will blame dentists for an injury that possibly would have happened under anybody's hands. And they will go to lawyers, and lawyers find it very, very easy, basically, to sue dentists for dental negligence. Once that happens and you're filed as a civil lawsuit, and it's not criminal, it's always civil. Civil being it's the civil courts. Every lawyer who represents a plaintiff who would be the patient, and every lawyer who represents a dentist who would be the defendant in the case, need to have an expert witness. The expert witness has to be a qualified dentist who does that work, who has years of experience, who would then be qualified to discuss the case in front of a jury. Now, an expert witness needs to be qualified in front of the judge. The judge would look at your qualifications, the years that you practice, the type of dentistry you do, and your education. Now, for me, I have over 45 years of clinical practice, which is more than enough. You need 5 to 10 years for a judge to think that you know what you're doing. I'm an assistant clinical professor of restorative dentistry at Rutgers, and I've been for years. And my education and my training do qualify for me. But many dentists would qualify as expert witnesses if they do that type of work. My main job as an expert witness is to explain the standards of care to the jury, because these are always going to be, almost always, they're going to be jury cases where all the evidence is presented in front of a group of non-dentists. Not one of them can be a dentist. They would be not qualified. They would not sit on a jury if they were a dentist, if they were a hygienist, if they were a dental assistant. Typically, lawyers want people who have no idea about dentistry to make decisions about us. So when we're starting to talk about things such as standards of care, which you and I think we want to talk about that today. My job as an expert witness in front of the jury for a defendant dentist will be explaining to the jury how that dentist met accepted standards of care. And we're talking about every phase of the practice, and we can talk about that briefly. But that is what a jury will use as decision making in whether a dentist is guilty of dental negligence or has no fault in that case. Now, for everybody who represents a dentist in the case, there will be an expert witness that represents the patient. So many times I'm in front of a jury and I have listened to a dentist excoriate a dentist who has been accused of dental negligence, and they discuss the standards of care and how they did not meet those standards of care. I, on the other hand, will use the evidence that I have in the case to present to the jury why that dentist should not be found guilty of negligence because they have met the standard of care.
So, Mitch, let me ask you this. So, when this whole process plays out, let's say, are you in control of who your expert witness might be? Let's say a claim gets filed against me and I say, hey, you know what? Mitch is amazing. He's fantastic. He's a friend of mine. I know him. He'd be great at this. Does the insurance company or whoever he's representing you say, no, we're going to use our own person, or do you have an input in how that would work?
So the dentist who is sued, for instance, what you're asking now, says, look, I have a friend of mine who's excellent. He knows dentistry. He's done this for years, and I would like him to be my expert. The insurance company will almost always say, I'm sorry, that's not going to be possible, because an expert witness is basically not an advocate for the dentist. That expert witness, whether it be a man or a woman, they are going to be an advocate for discussing the standard of care that they have found from the evidence of the case in front of the jury. I make it a point that I do not know personally anybody that I represent that I am working with in court. I don't talk to them before a case. I don't want to know what their opinions are about the case. I don't really want to know what they have to say about the case. What I want is I want the evidence of the case to speak for itself, because that is the most credible information that a jury will have. I don't want a jury to say, well, Mitch knows George, and he's going to say George is a great dentist. That is not what dental malpractice in a courtroom is. I almost, in over 35 years of doing this now, I rarely have ever met a dentist before I appear in the court to testify. I don't want a jury to ever say there is bias on the part of the expert. My job is to be as credible as I can using the evidence. And that's why, George, for us dentists, the evidence that we produce in a malpractice case it speaks for the case itself.
Yeah, so let's circle back to that, and we'll talk a little bit about ways to keep out of trouble and what you should be documenting towards your case. But let me ask you this real quick, and then I want to talk about standards of care. So when you go in this as an expert witness, are you deposed by the other side, the judge? Do they try to sort of unqualify you as a witness, if you would, or does that not happen? Is that not an issue?
Because I have enough experience, they typically know that I'm going to be qualified by every judge that I appear before in court. If there's a case that has a type of dentistry that I don't do in my own practice, I am not going to be the expert for that case. And I realize what I'm qualified to discuss. I want to say to the jury, I do this every day in my practice. It's a routine part of my practice. I understand it. I know what the standards of care are for this particular type of dentistry. And therefore, I don't have to question that. But the question that you had for me directly is, will I be deposed by other lawyers who will try to discredit me? And that is exactly what they do. It's almost, George, like I am on trial myself. So every case that I do as an expert witness, I feel like I'm on trial. And that's why most people who do dentistry for a living don't want to do what I do. Yeah. Because it's almost like you're being sued every time you go to court to work on behalf of a dentist, or sometimes if you have to go to court to represent the patient.
Yeah.
About 80%, maybe 85% of my work is in defending dentists. So I'm known pretty much in legal circles as a defense expert. people know that they can call me if they have a case that they want me to review for them. But I also, because of my credibility always being at stake, I never want a lawyer to say, hey, look, Dr. Gardiner, all you do is defend dentists. What kind of credibility do you have? So we do on occasion, and I have to pick and choose very carefully cases that I represent for plaintiff patients. Many times I take them because I find them to be wonderful teaching experiences that I can then take and then teach other dentists how we stay out of mistakes, exactly what you were saying. How do we stay out of mistakes? But yeah, to answer your question, when I am an expert for a dentist, I am going to be on trial just as much as the dentists themselves.
Yeah, and you've got a fantastic course that you give about this, and we'll talk about that later. But I could see how you could incorporate this kind of stuff. So, Mitch, talk to us a little bit about standards of care, because I think a lot of people don't understand that, or that's a misconception, or maybe they have some ideas that simply aren't true.
Well, I oftentimes will say in the courses that I teach, and there'll be 300-400 people in a room, can you give me the definition of what the standard of care is? And many dentists will sit and just ponder it and don't really have an answer. I'm going to give you two tenets, George, that need to be proved in court for a dentist to be found guilty of negligence, which will help us to focus on this question of standard of care. Only two things need to be proven in court. The dentist failed to meet accepted standards of care in the treatment of the patient. That's number one. So now already you know standards of care are definitely going to be discussed, because that has to be proven that the dentist didn't meet accepted standards of care. So that's tenet number one. The second one that has to be proven is that that failure to meet the accepted standard of care by the dentist injured or harmed the patient. Now that's it. So if you're a lawyer and you have a patient who, let's say, has an inferior alveolar nerve damage from a surgery or from an injection, what they have to prove in court is that the dentist did not meet the accepted standard of care in the treatment of that patient, and because of that deviation from the standard of care, the patient was injured. Now, if you're an attorney representing a dentist, you will say oftentimes, we're not going to argue that there is damage to the patient. There's an injury to the patient, but that injury did not result from any accepted deviation from an accepted standard of care. And that is how many dentists can prove that they have not been guilty of negligence. So the standard of care is going to be the center point, the focus of every lawyer in how they approach dental malpractice cases.
Yeah, so let me be clear that we're not giving legal advice here, but let me ask you this, Mitch. In some of the recent things that you've sort of worked on, what would be considered, give me a few examples of standard of care. So in other words, is, let's say, a CBCT for an implant standard of care. We know that rubber dam would be standard of care for endo, but what are some of the other things that we should know?
Well, never say, of course, we know, because there's many dentists who don't really understand any of this, any of the real specifics of standards of care. But let's start with the CBCT. So if you're doing implant dentistry and you're the director of implant dentistry for undergraduates in Nova, which is a tremendous responsibility, and I know you taught our dentist students in Rutgers very well in implant dentistry. It has always been that radiographically, you have to prove that you know exactly where you are and what you're doing to place implants in a patient's jaw. Now, the CBCT is somewhat new in dentistry. It has always been considered that the panographic X-ray was the standard of care. That is what, before we get into the specifics, why don't we just get the definition of what the standard of care would be for laymen? This is what is read to the jury. So it gives you a little better idea of what we mean when we're talking about standard of care, okay? What would the average dentist do under same or similar clinical circumstances in the treatment of this patient. If you have done what the average dentist would do under the same clinical circumstances, then you have met the accepted standards of care.
Okay.
Now, we're not just talking about the placement of an implant, for instance, in an implant case. We're talking about everything that goes from the beginning of the case to the actual end of the case. So you start with the medical history, where good medical history is always taken because that is what is the standard of care in every state that you practice. And we see many problems with people not having accurate dental histories, medical histories of patients, and then problems result from that. How about the treatment planning? Were the treatment plans presented to the patients so that they had every option that they could decide? And when you come to things like implants, we always talk about at least 3 things that you can do to present a treatment plan. So for our general dentists in the Academy of General Dentistry, we want to discuss with the patient, well, do you need an implant? Is it necessary to do that? Do you want to have one? And if you do want to have one, are there other options that you can pursue that may make more sense for that particular patient? So we're talking typically about leaving a space. We're talking about possibly placing implants and then doing either fixed crown and bridge or possibly removable overdentures and things like that, or just possibly maybe using partial dentures instead. One of the questions, George, that often comes up in court to the jury is, well, did the patient know when these implants failed that they could have just had a simple partial denture without having any kind of aggressive, invasive dentistry? And many times patients will claim, sometimes accurately, sometimes inaccurately, that they were never told of any other options. And that's where all of a sudden now your documentation of presenting those treatment options to the patient is going to be the evidence that we will use. Patient was told, this is what's written in the chart. Patient was told of every possible option: a removable partial denture, a full fixed bridge, not doing any treatment and leaving the space as is, or placing titanium implants. The patient was discussed every advantage and disadvantage and decided to have implants. Now that will stand up in court, and I can use that information to tell the jury, look, this dentist made it very clear to the patient all of the treatment options. That is our standard of care that everybody needs to follow. Now, if that isn't followed, you're going to have trouble if you have now failure in the implants or if you have injury from the implants.
Yeah, that's good stuff, Mitch. Mitch, listen, we've got to take a quick break for a word from our sponsor. When we come back, we'll pick up that topic.
This AGD podcast series is sponsored by DHP, one of the largest family-owned full-service dental dealers in the U.S. DHP provides dental and medical supplies, equipment repair, maintenance, technology, and equipment sales to clinics and practices nationwide. AGD members receive exclusive discounts and promotional offers when they buy from DHP. We are especially grateful for DHP's continued support of AGD. Their partnership helps make this podcast and the vital conversations we share possible. Discover why like-minded general dentists work with DHP by visiting their website at www.dhpsupply.com.
Hey, welcome back, everyone. We're here with our guest, Dr. Mitchell Gardiner, talking a little bit about some really important things, malpractice, expert witness, and how we can stay out of trouble here as dentists. And Mitch, you were talking about standard of care before we took the break, and you gave us a great explanation of that. And I think you were also alluding to some record keeping, which I want to talk to you about also. Like, what are the important things we need to note about here?
All right, so let's get right to the heart of the matter. When I have a lawyer call me, and typically it's never going to be a dentist who calls me and says, hey, look, I'm being sued and I need an expert witness. It's always going to be a lawyer that's been hired by your liability insurance carrier. Now, you and I have been in this profession for many, many years. We know that our protection is our liability carriers. Our medical malpractice carriers or dental malpractice carriers are the people who protect us. You cannot practice dentistry without sufficient liability coverage. That has to be for every one of our AGD members. That is the number one thing you get when you start practicing dentistry, and you make sure that you have adequate coverage, because if you do, this is not going to be a matter of money. It's going to be a matter of everything else. But it typically, only a couple of times in my career have I seen cases that have really cost dentists a lot of money, but it does take its pound of flesh out of everybody. So knowing that we have dental malpractice coverage, the lawyer will call me and say, look, I have a case, and I'll say, tell me what the case is about. Tell me who the dentist is. If I don't know the dentist personally, I want that to be part of my case. If I've had cases where patients have sued dentists, and unfortunately they're friends of mine, and I can't get involved because ultimately that discussion will come up in court. Well, you went to dental school with such and such, you know such and such, you're a personal friend of such and such, and then my credibility becomes the question and not the evidence. But we want to talk about the evidence. So what I do typically say to the dentist, let's say to the lawyer, I don't know, I do this work, I'm qualified to discuss it with you. I don't know the dentist. The very first question, George, I'm going to ask the lawyer is, how are the records? I know typically what I'm going to get as a reply. In the past, it's always been, well, they're okay. Mm-hmm. Now I know my work is cut out for me.
Right.
Because the centerpiece of evidence for every malpractice case that I've ever worked on, any one that I've ever worked on, is record-keeping documentation. Now, it's gotten much more complicated in the last 10 years. Ask me why.
Why is that, Mitch?
Well, because now emails, texts, social media, all of the things that our younger dentists consider part of their world on a daily basis are now part of the record. Because a lot of dentists will text with patients. They call patients on the phone. They will email them. That is all part of the record, and it's all discoverable, meaning the lawyers are entitled to get every bit of that information to present in court. And you'd be amazed what some of these messages that dentists send to their patients say. Hey, I'm really sorry that I hurt you today, and I'm sorry that things went badly today, but I'll make it up to you. And they'll forget about that because this case might go for another year before we discuss it. Now, all of a sudden, I have this incriminating part of the record, and dentists will oftentimes say, I didn't know that was going to be part of the record. Well, it is. So documentation is everything. From the minute the patient calls the office the very first time, through all of your dental record keeping that you keep in your practice, whether it be handwritten, whether it be electronic, the courts make no distinction, George, for us, whether our records are handwritten, whether they're electronic, whether they're video, it doesn't matter. They are the records, and the records speak for themselves. So knowing that, dentists now have to be always on alert as to what they're including in their records, what they decide to send to patients, how they communicate with patients. Remember, every phone call that we make to a patient is part of the record, and it's discoverable. And I've had many, many times where companies like Verizon and AT&T, their records are subpoenaed so that we can verify that dentists followed up in emergency situations, calling patients and things like that. Every pharmaceutical record that we write, whether it be handwritten, whether it be electronic, are all going to be part of the record. So our record keeping is everything. It starts from the beginning and it goes to the end, to the very end, and it's all discussed in court. It becomes a very complex clinical situation. It's not just, hey, this implant was placed in the mental foramen and now we have a problem.
Yeah, there's no doubt about that. And I was going to ask you, particularly some
Please
advice,
do.
particularly some advice for our younger members. But I want to say that, what you just told me, I'd be willing to bet that our younger members are much better at documenting things in the chart than some of our older members. Because in dental school, we have so many things, there's usually a lengthy description of everything. And I think that probably carries on a little bit, but I'd be willing to bet some of our older members have some challenges with documentation that you've seen. But any other advice for
I
our
would tell
younger
you,
members?
George, I would tell you that I believe you're correct on that aspect.
Yeah, just my gut feeling. I have nothing, no evidence for that. But any other advice for some of our younger members, those that are just getting out into practice? I mean, things happen. We all know that if you do enough procedures, something's going to happen. You're likely to have an adverse event. But anything that you could talk to our younger members about, maybe to reassure them about this process and what they have to look forward over the next 30, 40 years of their career.
How much time do we have?
I know that was a loaded question there. Maybe just one or two things, Mitch. You can just kind of, I guess
Okay.
record keeping would probably be the number one thing, I guess.
Record keep no, actually, record keeping is so important. For our younger members who are listening to this, because I've seen every mistake. I've done hundreds of malpractice cases, and I've seen thousands and thousands of my own patients. I'm in clinical practice every day, George. You and I have been doing this for years and years, and dentistry has changed a great deal. Patients really haven't, but we live in a very litigious society. If something doesn't go right, people sue.
Yeah.
There are so many lawyers out there in the real world looking for work that they will jump on a dental malpractice case much easier than we think they will. I do not practice scared. I never do. I practice careful. And what I would tell our young dentists, and I am a huge proponent of the AGD. I always say to our students in dental school, you will join the organized dentistry, you will join ADA, but you must, if you're a general dentist, you must be a member of the AGD, and you must stay active in the AGD. The AGD is our education, and education helps us to become better dentists. And when you are educated and understand today's standards of care, which have changed tremendously over the last 20 years from what they were 20 years ago, when you can stay focused on your education with what the AGD does supply on almost a daily basis, you will practice much more carefully. But if I had one bit of advice for my dentists, and I give it in my courses all the time, I give an entire course on medical history and informed consent and how important they are in your dental practice. What that means is you spend enough time, and believe me, I know it's difficult today. We have a lot of our young dentists who are practicing in different types of environments than you and I did, George, when we started. I have always been in my own private practice. I don't work for anybody else. I can determine how much time I want to spend with a patient, what I find important to speak with a patient about. And I think for our young dentists, if they truly want to stay out of trouble, aside from learning every day, spend time with your patient, understand their medical histories from the end. That is a difficult thing to do. Patients don't trust us when they come in for the first time. They don't want to delve into personal information that for us might protect them from the things that we do. They don't trust us until we earn their trust. And that means you need to spend the time with your patient, which sometimes you don't have that luxury. But it's so important to understand your medical health and history of your patient. Understand what your patients want from you. Talk to them about why they are coming in to see you, what they expect from you, what you can realistically do for them. And if you start that, you're going to start to earn their trust. And by earning their trust, they will start to be honest with you. Once a patient is honest with you, you need to be honest with them. If they want you to do something that is out of your qualifications, you just started dentistry and you have not done this procedure before, and you're not sure that you can do this procedure, I find that there's a lot of young dentists today who are overly aggressive in doing things that either one, they're going to have a hard time justifying to a judge and jury why they did it, why they didn't either refer it or have the patient look for other options, or not being totally honest with the patient. And that's when things really turn badly in court for us. So the two things for us to stay out of trouble: communication, documentation. Communicate with your patient fully, be honest with them, and try to get that honesty from them to you. And be honest with what you can and can't do. I don't know about you, George, but as I have gotten much more experience in what I do, there are things that I no longer want to do because I know that they have risks that for me are no longer palpable. I don't want to accept that risk.
Yeah.
If I have a difficult root canal treatment that I think the patient is going to be difficult, it's going to be difficult for me to technically do what I want to do, those are my patients that I will say, look, there's somebody out there who does it better than I do. I used to place all my own implants surgically, but there are so many more people who are better qualified to do it than I am. I no longer will do that. And I know people don't want to give up certain types of patients, but being honest with your patient will keep them in your practice forever, and it'll keep you out of court.
Yeah, I'm so glad you brought that up, Mitch, because there's two things that I think are important here. And you mentioned maybe an aggressive young dentist, but I think it's important for the younger dentist to realize it's okay if you tell your patient, "Hey, I think you'd be better treated somewhere else." Because I think sometimes they feel obligated that they've got to treat every patient because they've got the training and they feel that pressure, or maybe it's a monetary or a financial pressure, something like that. And it's absolutely okay to be frank with your patient and say, I think you'd be better treated somewhere else for that. So I think
So
that's a
George,
great subject.
you bring up such an important point for us as AGD members. We're general dentists, but we do root canal work, endodontics, we do periodontic work, we do implant work, we do exodontia, we do a lot of oral surgery work. We're in every specialty, but we are general dentists. Are we held to the same standard in court? Well, unfortunately, we are. We're held to the same standard as an endodontist, an oral surgeon, a periodontist. It's a very difficult, it is such a difficult track to take. Being a good, highly educated, highly qualified general dentist is the most difficult aspect of anybody doing professional dentistry. If I did nothing but root canal work all day long, it's a breeze. But we do everything. So remember, as a general dentist, you are going to be held to that standard of the specialists. And there are tons of specialists, I hate to say this, who can't wait to get into court to say, that general dentist should never have done this implant work. That general dentist should never have done this endodontic work. I don't have a problem discussing general dentists being qualified to do all of this type of dentistry in court, but I need to have the evidence to back that up. And when you say it's not bad for it's really good for a young, inexperienced general dentist to say, look, I'm not prepared to do this for you. I can send you to somebody who is. One that tells the patient, I have an honest dentist in front of me.
Absolutely.
They don't care that you're inexperienced. They'll work with you on a lot of things. When you say, this is something that I can do for you and I can do it well, and you earn their trust, they will be your patient. When you say, I think this is something that we can find somebody who's better qualified right now to do for you, you are doing one, you're doing your patient a tremendous service, and two, you're learning how to be the best professional you can be.
No question about it. Mitch, I'm glad you brought up education because AGD 2025 in Montreal, July 9th through 12th is right around the corner. And I hope
George, I wish I was going to be up. I wish I was going to be there to present some courses, but I'll be there in Las Vegas in 2026. One of my very first courses that I ever gave was in Nashville for an AGD meeting, and it got me started in presenting courses. And there is nothing like sitting in a room with a bunch of dentists and discussing our problems together, because that is how we learn. I never walk out of one of my courses without learning something myself from somebody in the room. And you just can't do it as well online. Your live courses that you present for the AGD are a blessing. And I highly, strongly recommend, and this just comes from years of experience of educating dentists for many, many years. Being there, interacting with your fellow professionals, asking questions directly to the so-called expert about what you want to learn, you'll walk away with something that you can use in your practice for the rest of your life.
No question about it. And Mitch, we're running short on time, but we've talked a little bit about malpractice. I mean, we could talk about this all day. And I know you've got at least one or two amazing courses. I've seen you in action. You're a great educator. You go really into depth in all these really important subjects. If one of our listeners, and there's a lot out there that book speakers, if they wanted to get in touch with you, how could we do that, Mitch?
Oh, please do. I can give you my email, my office number. There aren't too many Mitchell Gardiners around. Most people find me. My practice is in New Jersey, in Shrewsbury. I have an office number, which is 732-741-5533. You can call me. I get calls after I give courses. I typically will get, for the next 3 or 4 weeks afterwards, I'll get calls from people who say, I have this question. What should I do? I don't give legal advice because I'm not a lawyer, and I'm happy to say that I'm not a lawyer. I'm a dentist. But I can find the right people for most people who have questions that I can't answer. I can find them the right references. So my office number, 732-741-5533. And you can always call and ask. The ladies in my office who take care of my reception work will always get that to me. And my email address is mgardiner155@gmail.com. I typically do, for a lot of the meetings, I do all the major meetings in the country. Although, unfortunately, we're going to see an end to the ADA's national meetings. This is the last one in Washington. We will no longer have a national meeting for continuing education, which is really sorry for us. I do a lot of study groups where we'll do a 3, 4, 5-hour all-day course. Anybody who wants to get in touch with me can find me. And I am more than happy to still help people. I have a very busy practice, and I have a dental practice at Monmouth Park Racetrack here in New Jersey, where we help a lot of the people who work on the backstretch. I do, my hands are in patients' mouths almost every day. So I'm not one of those people like George and I, when we worked together at Rutgers, we both did what we did. It wasn't like we were just teaching and didn't do it. So oftentimes other professors would send their students to George and they say, Dr. Schmidt, he knows how to do this because he does it all the time. And that's what we need from our educated people today. Do the work yourself. You know where you make your mistakes. You learn what works. You learn what doesn't work. You learn how to treat your patient properly. And with that, and with a little bit of luck, you'll never end up in court with me.
Yeah, absolutely. And Mitch, I'm glad you brought up the work you're doing at Monmouth Racetrack there, because a lot of people also don't know that in addition to being an expert witness, an amazing clinician, and an educator, you're really you're a very philanthropic and generous man. I know you've got some endowed scholarships that you created at Rutgers University for the students, which of course is appreciated. And I know they have you over there to speak to the alumni and things like that. And you're always available, always willing to chip in, Mitch. And I just want to thank you on behalf of our profession, for sure.
George, when you asked me to do this podcast, I was delighted because there's very few people like you that I have met in dentistry who have given back more than they've gotten. I mean, I know the type of clinician you are, and I've watched you teach. And if our schools were filled with people like you, we'd have better trained dentists today. It's a pleasure, and watching you do what you do now with the AGD, which is really, I always felt I did a lot of work with the ADA over the course of years, teaching and stuff. And I was a member of AGD from the time I went into private practice, and I will always be a huge proponent of people like you who push our profession to the highest level we can do. So for me, it's a pleasure, and I sometimes look at it more as it's not work.
Yeah. Well, Mitch, thanks again for coming on. Maybe we'll have you back and we'll talk about a little bit more about this and some of those other things like your contribution at Monmouth Racetrack. But thanks for coming on the program, Mitch. Really appreciate it. And thanks for the kind words.
George, good to see you. Good luck down in Nova, and I'll see you down the road.
Absolutely. And I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on the AGD app, Spotify, SoundCloud, Apple Podcasts, and YouTube under @General Dentistry. If you have any questions, concerns, comments, or suggestions, contact us at news@agd.org. Thanks again, and we'll see you next time.